Airbus 99 lifted.
They fly in some of the UK's most dramatic landscapes.
Okay, the weather's starting to close in. I'm worried I can't get over the ridge. My escape option at the moment is to go up.
From high-rise city centres...
It's going to be bumpy, it's going to be turbulent, guys.
...to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, Ellen?
The crews of Yorkshire's 2 air ambulances risk their lives...
Gone unresponsive.
It's just gone unresponsive on us.
...to save yours.
There's potentially fatalities involved.
That car's a right mess.
Delivering intensive care by air.
It's not safe.
There's a lot of blood there. There's a lot of blood there.
No matter how critical the case...
This is the first time anything like this has ever happened.
We're circling a house fire.
However risky the place...
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee. You're having a heart attack, okay? The heart is blocked. Let's get loaded and go.
Going to extraordinary lengths.
Hey, this from Medic 2 at the patient's side, however.
With humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
Okay, Chick, we're just going to get you out, alright? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
Right, can you attach that to his drip, please?
The team fight to save the life of a cyclist who's been hit by a car.
So he's actually got an arterial spurter there? Covered in blood here.
A woman is seriously injured after being thrown from her horse.
Just try and calm down for me, sweetheart, alright?
You've had a bang to the head. We'll just get you onto the stretcher and onto the ambulance.
And a DIY disaster leaves a pensioner with a serious head injury.
I had a piece of box section I put across my garage doors.
It just fell on him, and he sat outside holding a cloth and he's covered in blood.
Ambulance service, is the patient breathing?
It's rush hour in winter, and a distressed woman in South Yorkshire is calling 999.
So he's been hit by a car? Yeah. Was he on a motorbike? Yeah, he was on a bike. Right, okay.
In the crew room at the Nostell Air Base, the team are listening in to what sounds like a hit and run.
Jumpy! Tell him to keep nice and still. I don't know the extent of his injuries at the moment.
You just said there was a lot of blood, so I'll send you.
Dispatcher Tyrone is scrambling HeliMed 99.
This is a motorbike v car, is it?
I think so, yeah.
I wasn't sure if it was pedestrian.
Alright.
Details are sketchy, but there's no time to lose.
Good luck.
Dr. Tim and paramedics Pete and Lisa are taking off for Doncaster. Flight time is 5.5 minutes.
Airbus 98, do we know what resources and ETAs on this detail?
You've got Tech 2 crew just pulled up. This kid's got a broken leg. He sounds really irritable on the phone and agitated, and he's got a serious leg fracture.
He wasn't wearing a helmet. That's what the ties just passed.
He was agitated, combative, he wasn't wearing a helmet, so I'm already mentally thinking, oh, this could be very bad news. He could have a serious head injury.
Got some blues.
Right.
Still not see with a light traffic element there.
Yeah. Oh, it's quite built up.
Yeah, it is, isn't it? I'm looking at these big car parks down here.
HeliMed 99 is over a busy lakeside sports and leisure complex. It's going to be a difficult place to land.
So you're right over at water now, Jeff?
I know, yeah, I'm going to put it over the other side over there. Just check that tree behind us, please.
Pilot Jeff is descending in darkness. He needs the eyes of the whole team and the help of night vision goggles.
Should be a tree behind beside
close
us.
to this tree.
That's all right. It's not
It's still a little tiny tree, but
it's not as high as us, is it?
It's a long way away. Quite sloping this and all, Jeff.
Yeah, towards me.
Yeah. It's very high up right on side.
Oh, right. Yeah.
I'll jump out in case anyone comes up.
Yeah.
I'll clear out, yeah?
They're safely down.
Is it down here and right? Took main road, yeah.
Pete and Dr. Tim have a short walk to their patient, who's at the side of a fast and busy road.
We find a little crossing, don't we? Yeah, when this next car's gone, we'll make his way over.
He's in the care of local paramedics, The driver of the car which hit him did stop.
What's he like?
He's not responded at all to us. Quite a bad head injury.
Hello.
Hi.
How are we doing?
What sort of state's he in?
Right, I've only just arrived myself, and this is Andrew. Andrew's been going across the road by car doing 35 to 40 miles an hour.
Okay, so he's got an airway.
He has at the moment.
30-year-old Andrew Stewart was crossing the busy road when he was hit by the car which threw him into the air.
Sort of good head injury going on there.
He has deteriorated rapidly in the minutes since the 999 call.
Feels alright, belly's soft. Have you listened to his chest, my friend?
I've literally just got in, so.
Do you want to have a quick listen?
Yeah.
Let's look at his pelvis. Looks okay.
Andrew was on his way home from his job in retail when the accident happened. He lives close by.
Where's this leg injury then?
Left leg seems abnormal. Not open.
So his GCS is a bit disappointing. What's pupils doing? Andrew, stick your tongue out for me.
Andrew is now dangerously unresponsive. Without swift medical intervention, Dr. Tim knows he may die. He wants to get him straight to hospital.
How far from Donny is he to drive?
About 5-7 minutes. Yeah.
The nearest hospital is in Doncaster, but it's already stretched to the limit.
Is he manageable for us?
I think he needs tubing in the near future.
Okay.
Well, it's just whether we do it here in the middle of nowhere and freezing cold, or if we take him to Donny, which is a bit easier. So he's bleeding quite a lot from that head injury. Okay, let's get IV access, prep him for RSI, get him tubed here then.
The team can't wait. To save Andrew's life, they must anaesthetise him in a procedure called an RSI, and they'll have to do it at the side of the busy road. They need more room than the cramped ambulance affords.
Tim, you happy here, facing back at DCS?
Head up. So head, feet.
So I'm setting the kit dump up. If we can get IV access, make sure we've got some ECG monitoring on. Suction out and ready with Yanker attached, please. We've got this pedestrian that's been knocked over and he's received a significant head injury. It appears to be isolated at this moment in time. So in order to protect his airway and any potential brain injury that might have occurred, Tim's just going to carry out a procedure called RSI to pop him to sleep and take control of his breathing. That way we can monitor the parameters much better than we would be able to manually sort of managing his airway.
You alright here?
Just a touch further, please. Is it definitely flushed, yeah?
Yeah, flushed well.
Fantastic. Can you get me a litre of saline on a giving set, yeah? Thank you.
Andrew, keep nice and still.
Got battle signs under eyes, haven't he now, Tim, as well?
They're placing Andrew into a medically induced coma, a procedure usually carried out in a hospital.
Right, can you attach that to his drip, please? Is that in?
Yes.
So long blade, bougie, 8 tube.
Dr. Tim can now see the full extent of Andrew's head wound, and it's dangerously deep.
So he's actually got an arterial spurter there?
Yeah.
Never rains but it pours. Right, is there a spare paramedic? Can you get me a bit of Celox? Just cut a little square of Celox. Or just bring some out. Right, are we all ready to go? Doing an anaesthetic by the roadside is a high pressure moment. The stakes are high. If you get it right, you've given your patient the best possible care and chance of good recovery. But unfortunately, if you get it wrong, there is potential to actually kill the patient. Right, so fentanyl, ketamine,
That's 100% still.
covered in blood here.
Did you just pop that dressing over?
Yeah.
The team are sedating Andrew. Once the drugs kick in, they will take over his breathing.
That's a minute.
Okay, let's have a look.
By the light of a head torch, Dr. Tim must access Andrew's windpipe.
Okay, I've got pretty good view. Tube, please.
He's passing a breathing tube directly into Andrew's lungs.
Thank you very much. Hold it nice and tight.
There's no room for error.
Okay, pooge out, please. Cuff up, please. Right, who's the star with the stethoscope?
They've done it. Andrew is successfully anaesthetised, and the team can pump air into his lungs.
Super job. Yeah. Right, Pete, can you help me secure the tube, please? Lisa, can you please press blood pressure so I get blood pressure? Yeah. It's a really firm pressure, buddy, that's good.
128.85.
Oh, what a cool RSI. It wasn't too bad in the end, actually, Pete.
No, I thought that, but I had every confidence in you, Tim, to be fair.
Thanks, Pete.
So we're going to go by road to Northern General. We're only a stone's throw from Doncaster, but it's not a major trauma centre because of the extent of his injuries. He needs to be at a major trauma centre, so the plan is to go by road.
Andrew isn't out of the woods yet.
Right, up we go.
Okay.
The race is on to get him to Sheffield's Northern General Hospital, 20 miles away.
So we'll keep an eye on his pupils, Pete. Maybe give him some Ibutonic if he starts looking a bit dodgy.
His condition is critical. Going by road will give the team more room to work on Andrew.
Hiya, it's Yorkshire Air Ambulance here, one of the paramedics. Can I put an atmist in for a trauma patient that's coming by road, and the aircraft will be following on behind, empty to pick up the crew?
It's almost 30 minutes by road, but Andrew's head wound can't wait. This life or death journey will require all of Dr. Tim's skill. Racing to hospital on blue lights, Dr. Tim and paramedic Pete are in a desperate fight to save the life of 30-year-old Andrew Stewart, who's critically injured after being hit by a car.
You can see where it's spurting from, actually.
Yeah, I could see it with the light behind it.
To protect his damaged brain, Andrew was anaesthetised at the roadside. He's too unstable to fly, so they're travelling by road.
Do we have stitches in our bag, Pete?
No. We have got sutures, haven't we?
Andrew is still bleeding heavily from a severe wound to the head, and they are 20 minutes away from hospital.
So Pete, would you be able to just cut it? Yeah, about there, just where your thumb is.
Yep.
Thanks.
Do you want to ask crew just to steady a bit?
That's right.
It's an arterial bleed. If Andrew deteriorates any further, he may die. Dr. Tim has no choice but to try to stem the bleeding by stitching.
Stitching someone's head up in an ambulance, it's not ideal. I'm not a surgeon, I'm an anaesthetist, but it was quite important to try and stop the bleeding.
And if you could just cut that for me, please.
We've got a saying in pre-hospital medicine, every red blood cell counts. So I did do just a few basic stitches, and that seemed to do the trick and stop the bleeding.
So can we think of any other drugs that we need to give him, or any other things we need to do? I mean, you don't really need a pelvic binder. I don't think he's got any evidence of bleeding. His pelvis looked fine to me. We've got 2 IV accesses. I can't think of a single thing more to do.
Yeah. Right, with that.
At last, they've reached Sheffield's Northern General Hospital, where a full trauma team is assembled and waiting for Andrew.
We're ventilating nicely. Yeah, let's go.
The air ambulance crew have done all they can. Andrew's life is hanging in the balance. The hospital trauma team will now take over the fight to save him. It's lunchtime at the Nostell Airbase. Pilot Gary has a meal ready in minutes.
Go, Gary. Yeah.
But it looks like lunch is destined for the microwave. Gav has another emergency for the crew.
What is it? It's a female fallen off a horse unconscious, Sheffield.
It's a case that won't wait.
Fine, Gordon.
Confirmed outside distance structure.
Positive from right. Closed and secure.
Gary is flying Hungary paramedics Rachel and Andy 15 miles to South Yorkshire.
We're heading to reports of a lady that's fallen off a horse and is maybe unconscious. So we're quite concerned that she needs managing appropriately. She may need someone to make sure she's actually able to breathe properly if she's unconscious.
Nearly 2 million people in Britain regularly ride horses, but is considered to be one of the UK's most dangerous sports.
I don't know if that is it. No, it is, yeah. Reckon?
I would have thought so. It looks like a horsey place.
It looks like a horse. Yeah, it is that place, yeah. Got an RRV there.
The accidents happened at a stables. Gary, whose family rides, will have his work cut out landing nearby.
Horses in every other field. This is going to be interesting.
Try not to freak the horses out too much.
Oh, every field's got an horse in it. Can't see any patients.
Is it in arena? Are we better off landing in this field here?
I'm going to land in that field there and walk them.
We're going to have to land a little bit further away and walk because there's too many horses.
A little pony having a gallop.
the track to walk up there?
Yeah, just walk. It's only 100 metres, mate. It's the best you can do.
Have you seen it happen?
No, the girls are with her house.
Lying in the stable yard, 54-year-old Yvonne Late is being treated by local paramedics.
What's she done?
Horse has gone forward, she's gone forward with it, then it's booked, and she sort of swung off sideways and landed flat on her back.
Right.
And bumped her head as she's gone down.
Yeah.
LOC / a bit of confusion initially. I haven't had a chance to have a look at the helmet yet, so I don't know if there's any massive damage. Yvonne? Are you in any discomfort or pain at all?
Yeah.
Your head? Okay, whereabouts on your head is it?
Jaw.
In your jaw? Okay. Anything pain to touch, or is it just an ache? This side? Just have a feel of the back of your head, my love. Yeah. Does that hurt where I just pressed?
Yeah.
Okay. We've got a wee little bump there. Yvonne, are you able to lift your left leg up just in the air? Just bend your knee. Bend your left knee.
Yvonne is confused and barely conscious. Andy needs to know where else she's hurt.
Get nice and steady. That's it. And just hold your leg there. And down. Where's that hurting?
My back.
Bottom of your back. Okie doke. And sorry to just do the same there? Okay. Is that same place? I'm just going to have a little feel. And a little feel just down here as well. I just want to... Any pain around there? In where I'm pressing there? No. No, cool. Right.
Yvonne was heading out for an afternoon ride with friends when her large horse Chance bucked her off onto the concrete yard floor. It was a significant fall.
Yvonne, there's nothing to worry about, okay? You've had a bang to the head. We'll just get you onto the stretcher and onto the ambulance.
Lift this arm up, sweetheart.
As she regains consciousness, she's becoming increasingly distressed.
Yvonne, just try and calm down for me, sweetheart, alright? Just try and calm down. You're gonna be alright. You're gonna be alright.
Just moving this jacket.
Is it the pain that's bothering you most, Yvonne? You just don't know what's going on? Alright, you're gonna be alright, sweetheart. You've had a fall off your horse and you've had a bump to the head. Yeah? But you're gonna be fine.
Around 70% of riding accidents end in some sort of head injury, including concussion and brain injury.
Hi mate, yeah, just job was described. This lady's come backwards off the horse, so backwards and sideways, landed flat on her back. Isolated head injury. I think she's going to be suitable for local trauma unit, but I'll get back to you at location, right?
Yvonne, just relax that head down. Is that a bit more comfortable? We're just going to have to bob these blocks on, sweetheart, just because you've had that bump to the head.
As a clinical technician in A&E at Sheffield's Northern General Hospital, Yvonne is used to seeing serious cases. She never expected she'd be one of them.
On lift then. Ready, steady, lift.
We'll get her on board, we'll get some more rods on and just give her another quick assessment now she's packaged up. Right, Yvonne, you've had a fall off your horse. Okay.
Oh yeah.
Alright. Are you in a lot of discomfort with your head at all at the moment? How's it feel?
My jaw when I move hurts.
Okie doke. Do you want a bit of pain relief?
I'm needing phobic.
You're not? Right.
A nurse with tattoos.
Yeah.
Is it just if you look? Is that when you don't like it?
While Andy tries to reduce Yvonne's pain, Rachel wants to check out her protective riding gear.
She was wearing a very good helmet. Yeah, you can't put a price on decent kit, can you? Yeah, there's no damage to it. Is there nothing visible or anything that you can feel? So it's obviously done its job. Yeah, no, I'll leave that with you guys. Andy,
yeah.
Helmet's intact. There's no marks. It doesn't feel like there's any damage to it. But obviously, it's done with now.
Yeah.
It won't get used again. But yeah, it's there's nothing obvious on it.
It looks like Yvonne's helmet has saved her, but she'll need scans in hospital to rule out a brain injury.
Right, Yvonne.
No. No.
That's it. That's the hard bit over. Okay. Yeah.
Did you feel it?
Cheers, guys.
Thank you very much.
See you later.
Bye. It's like she's going back to work, really, isn't she?
Yeah, she is. She is.
Yvonne's been on her horse when it's bucked and thrown her off. She's landed flat on her back, so she's been winded and probably been knocked unconscious for a little while. We're not 100% sure how long, but she was quite disorientated when we first arrived.
She'll go by road to free the helicopter for another emergency.
We're just going to get her down to Sheffield for an x-ray and a check-up. See you later, guys. See you guys. Thank you very much.
Yvonne will soon be in the care of her colleagues. Head injuries can have long-lasting, debilitating effects. She could be months in recovery. The team's paramedics like to keep in shape, but ex-army and fitness instructor Andy is the keenest. Even when he's taking it easy, he's thinking about exercise.
I've got a delivery of gym equipment coming next Wednesday.
What's that?
So I've got battle ropes coming, that bench, and that rubber dumbbell rack.
But the weighty discussion will have to be put on hold. The team have some real heavy lifting to do.
Unconscious man in street. I think you're going to arrest this guy. Not far from Elgington.
25 miles away, outside York, there's a medical emergency. Paramedics Gav and Steve are on the case, with Dr. Paul.
Finished to flight. Flight engaged. Confirmed fuel. Fuel just over 500. Under 500 got the key, yep. Risers down. Autopilot. Autopilot engaged. All clear left, clear right.
Pilot Owen will have them there in 10 minutes.
9 Alpha low, it's 145, 5 PLB, lifted from Knoxville, routing to Elvington area.
We're going to a gentleman that sounds like he was carrying some furniture, and then he's collapsed shortly after that, and on the call he sounded like he was unconscious. So this person's going to have been exerting himself. That may point towards him having some kind of problem with his heart, some kind of cardiac event.
It sounds like the man's life is on the line. Speed is essential.
Is it a village location, isn't it? Yeah, it's Weldrake if you... It's just, there's a big field opposite the
house is the second house up from the field on the south.
So just a quick wide pass, left hand turn into wind, and then we'll go for it. Paul, there's a DCA just coming round the corner. I see people out on the pavement there, look.
Yep, got you.
Still looks fairly flat and only for A-trim.
The team are taking their full resuscitation gear.
RS Medic 3 at scene. Alright, sweetheart, okay, what's your name?
So this is Malcolm. A friend just told me Bruce Seeking for events. Moving a mattress
Hello,
in the
Malcolm.
garage. Suddenly just felt unwell and came outside and said it felt like he was going to faint. So sort of lowered him to the ground before he fell.
Malcolm Wykes and his friend Pam were helping a sick neighbour move furniture to make room for a hospital bed.
Malcolm. Hello, my name's Steve. How are you feeling? Have we had a brief handover from the crew? Have you got any pain there at the moment? No? Okay. You put yourself to the floor, Malcolm? Yeah? So he's not banged his head or anything like that? Squeeze my hands, Malcolm. Give me your hands a squeeze. Good. And that one. Give me a squeeze. Good. No pains around here? Can I feel the radio? Not at the moment.
Malcolm has angina, and heart problems run in the family.
Hiya, I'm Paul, one of the doctors. Pleased to meet you. What's your name, my love?
My name's Pam.
Okay, and you're...
He's just a friend of mine. We walk every day together.
Were you here when this happened then? What happened?
Well, this gentleman at number 3, he's end of life, and Malcolm and I came at 9 o'clock to move the bed base out, waiting for the hospital bed to
Sure, in
arrive.
terms of, so you're moving the bed out, were you?
Yeah, he was absolutely fine.
Okay.
But then he just said, I'm feeling really hot.
And then what happened then?
He just said, I think I'm going to faint.
Malcolm felt lightheaded just after he and his friend Pam moved the furniture. The team are trying to pin down the cause of his collapse.
Whereabouts, Malcolm? Across your chest this morning? What did that feel like?
Sharp pain.
Okay. And you have angina, don't you? Did it feel like your angina pain? Yeah. It did?
And the ambulance people said, lie him on his back, which is what I did.
Okay, lovely. Now you've done the right thing.
Malcolm is awaiting hospital tests. Dr. Paul suspects an abnormal heart rhythm.
Right, Malcolm, so the plan is we're going to get you off this floor, pop you on the back of the ambulance, and then we're going to do a 12-lead ECG, just have a look at your heart to see what's going on. Okay. Alright, Malcolm, just roll up your arms to the side of us. You're a bit chilly.
My gut feeling will be York with the crew, but we'll probably just need to have a quick.
Then Malcolm's worried daughter arrives.
Don't panic, it's all okay. I'm Paul, one of the doctors, pleased to meet you, okay. Just let these guys do a couple of bits and bobs and we'll get you on there to have a chat with him. He's chatting, he's talking, he looks fine, okay, so just relax, okay. He's just had a bit of a funny do, for a better way of wording it. Yeah, so I think these guys are just having a quick...
Yeah.
Tell you what, Steve, I'll just have a chat with his daughter while you're... Give me a shout if you need anything.
At times like this, it's not just the patient the team have to care for.
Just keep nice and still for us for these next few minutes, Malcolm, while we just get a good ECG reading. Nice and relaxed, okay?
I know he's worried about having a heart attack.
Got you, okay.
So his mum died of a heart attack after having been told she was perfectly fit and healthy. She dropped down.
Okay.
So it's on his mind that he's had quite a lot of chest pains over quite a long period of time now.
Heart disease kills 1 in 4 people in the UK, and the risks rise with age.
You mentioned you've had these funny do's before, is it? So when was the last one, or how often does that happen?
The last time he got taken in was probably about 3 or 4 weeks ago.
Sure.
Now.
I'm sure she can bob on just to make, just so she can have a chat when you guys have done your stuff.
But Malcolm's heart printout doesn't appear to be showing anything serious.
There's nothing acutely on your ECG, which is good to know. But what we're probably going to do is pop you down to the nearest hospital, which will be York. Just probably have some blood tests done to ensure that nothing cardiac has sort of happened, and that'll be the test we need to know to make sure that it squares everything up.
Thank you.
Okay, does that sound all right?
Yep.
Can I get your daughter on?
Yeah.
She's more worried than you are, I think. So, on the face of it, this just could be what we call a simple faint and nothing more than that. But with somebody with likely coronary artery disease, this all could be related to an issue with the heart or with those arteries.
Malcolm's off for a checkup in York. His good deed for a neighbour has landed him in hospital for the 2nd time in a month.
No, let's get to hospital.
1,500 feet above West Yorkshire, Helimed 99 is heading back to the Nostell Air Base. Then, dispatcher Kit has another mission for the team.
Might have something in Bradford for you, stand by.
Yeah, Roger, will stand by.
24-year-old has come off with chest injuries, ineffective breathing.
An off-road biker has come off his motorcycle. Kit wants the team to divert.
It's an off-road centre near Tong. So, Tong between Leeds and Bradford.
It's an about turn for paramedics Andy and Matty and Dr. Paul. They're heading 5 miles to a motocross bike track. It's a hardcore off-road sport, but when accidents happen, riders can be a long way from rescue.
Wood, over on the right, 1 o'clock. Alright, okay.
At a cruising speed of 160 miles per hour, Pilot Lee has the team over the wooded track in less than 5 minutes.
There's a lot going on there, isn't there? Yeah, there is.
With all them like caravans and stuff?
Yeah.
Next to that lit?
Yeah. So there's a van in the middle of the woods.
Yeah, that's Silver. Waving.
Got it.
So 1 o'clock where you are, Lee?
Yeah, got it. Thanks, mate. So a bit of a reverse slope, so let's just sort of get down into the by the trees and then.
Yeah, I'll keep an eye on the tail.
Thanks, man. Hopefully it's a bit flatter down here. Yeah, that's what I'm hoping.
Got that guy there, mate?
Yeah, I've got that, don't worry.
I think that might be our patient that's sat up looking at the aircraft now.
Is that him here, guys? Just in the grey? Yeah, cool. Just in there.
What's your name, mate? David, my name's Matt. I'm one of the paramedics. Can you tell me what's happened today, David?
I went into that tree on the bike.
Okay, mate. Were you knocked out at all? Remember everything that's happened?
24-year-old David Kerr is in a bad way. His body was flung into the tree at high speed when his bike caught a stump. His right side took the full impact.
Any pain in your neck?
No.
No? Any pain down your back?
No.
No?
I'll just squeeze in there, buddy.
Got it, mate.
Other than where you're holding now, is it hurting anywhere else? Okay.
Other bikers saw the accident happen A track official stayed with him until the helicopter arrived.
Just to make you aware, lads, as well, his helmet come off. That's his helmet. There's no impact damage on it, but it did come off during the accident.
Cool.
But he has been conscious all the way through, to my knowledge.
Great.
With no obvious broken bones, paramedic Matty suspects David's injuries may be internal.
Right, mate, as best as you can, take a deep breath in and out for me. And out. And again. Got bilateral air entry. Just have a quick feel on here, mate. So there.
Squeeze the sand in and out.
Any pain here?
No, just aching from what I've been here for ages.
Alright, mate, anything in your legs?
No, just aching.
Aching, okay. It's quite pale. Blood pressure's a little bit lower than I thought it would be for a gentleman.
David's falling blood pressure is a sign he could be bleeding internally.
So I'll give you this nice and steady, okay? This is a really strong painkiller. It might make you feel a little bit sleepy, might make you feel a little bit sick, okay? Just gonna go 2 milligrams to start with, mate.
Right, I'm gonna bob you this mask on, mate, okay? We'll get you some more painkillers up and running, alright? And then we're gonna get you out of here, we're gonna get you in a warm sleeping bag with that warming blanket that you've got on now, alright, mate? We'll get you down to the ambulance, then we'll have another good look at you from there, okay? Okay, we're gonna go on roll. Yeah. Ready, steady, roll.
With the help of local paramedics and other riders, the team will carry David 200 yards to the Warm Road ambulance, where he can be examined fully.
Ready, steady,
we'll be alright.
We'll go nice and steady. There's plenty of us here to swap out if we get unsteady, alright?
David's been motocross riding for 2 years. Today is the first time he's come off his bike, and it's left him with serious injuries.
Right, Dave, we'll see you down there, mate, yeah? Because it looks like you've broken your ribs here, and then your liver lies right underneath this bit as well, alright? The worst case scenario is you've damaged your lungs, you've damaged your ribs, and you might have damaged your liver. So if we treat for worst case scenario, we're not going to miss anything, alright? So that's why we've got you on some oxygen, and we're keeping the control of your neck. We're giving you some strong pain relief, and now I'm going to give you some medicine, so that if it is worst case scenario and there is some bleeding, this medicine will help with the bleeding.
A laceration to the liver can cause catastrophic internal hemorrhage. David is deteriorating fast. It's time to go.
My main worry at the moment is that he looks pale. His blood pressure's quite low, so it's about 85 systolic. For somebody his age, we'd be expecting it to be well above 100.
Dr. Paul and Matty are staying with their patient. They're heading to the major trauma centre at the Leeds General Infirmary.
Nice and steady, please, thank you.
David's injuries are now life-threatening. The team will do all they can on the journey.
So we're only 6 miles from it, it's not far.
Where are we going? Which area?
Home Firth.
Oh, it's nice over there.
Yeah.
Helimed 98 is heading for a town on the edge of the Peak District, where a DIYer has a head injury.
You've got 5 minutes.
On board are paramedics Mikey and Lindsay.
We're going to an 83-year-old gentleman in Holmesfirth who has been hit on the head by an iron bar that's fallen from some height. It's been reported that he's bleeding quite excessively and it's possibly the sounds of an arterial bleed. So we're going to go and have a little look and see what we can do.
Uncontrollable bleeding can cause cardiac arrest within a short period of time.
Head from 98. What resources have we got on ETS, please?
There's no resources running at the moment, Mikey. There was, but it's been stuck down.
Roger.
Mikey and Lindsay will be the first paramedics to reach the patient's side.
What glorious views.
Okay, 2 miles. Just in there where their trees go off to the left, innit? Aye, lad.
They're circling the hills that became famous as the setting for the TV comedy Last of the Summer Wine, which was filmed in Holmesfirth.
I think where that football pitch is pretty much where it is. Nothing on that side, nothing on that side. Okay, we're down. 98 landed.
The patient's being looked after by his wife.
Are we here?
He's here. Yes.
Oh, we're here too. Can I come in?
Yes, of course you can come in.
Oh, there we go. Oh, it smells like TCP.
Yes, well.
It fixes everything, that, doesn't it? Hi, Mike. This is Lindsay.
What's your name?
Keith.
Keith. Keith, tell me what happened. Let me have a hot keep on that now.
I have a piece of box section I put across for the bar across my garage doors, and I prop it up, and I propped it corner, and it came. I turned to open the doors, and it fell on me.
Retired car mechanic Keith Horn is 83, and he has a nasty gash on his head from the falling iron bar. His wife Sandra rushed home to help him.
Is it sore where I'm touching?
It is a bit.
There's loads of blood everywhere where it happened.
Well, in garage, down past.
Relax.
I've been trying to swill it and brush it away. We thought it had stopped at one point, and it were worse. It was spurting.
Spurting blood is a concern for Lindsay. She's applying pressure to Keith's wound.
Have you got any pain in your head apart from where I'm pressing?
No.
No headache or anything like that?
No, only what wife gives me.
You'll be having more in a minute.
You didn't do this, did you? Did you clobber him one?
It's a decent ooze. I can't find anything yet, but it's going to come from in here. Can you lean your head forward a bit? There we go. It's going to be uncomfortably tight.
All right?
Yes, yeah.
Sweet, good.
Yeah.
Not cut circulation off to your head, have we?
Well.
The question is, can you still see? Because normally we just go over the eyes.
It's essential that pressure is kept on Keith's wound until it can be looked at in hospital.
Have you got the pole?
Can I go look?
You can go, yeah.
Let's go have a look.
Sandra's showing Mikey where it happened.
Oh, we've got a classic car as well.
That's where we're supposed to be going off it at tomorrow. This was it.
And where was it?
It was propped up there.
It's quite long then, yeah.
And it's heavy.
Yeah.
You can feel the weight of it, just lift it up.
Oh,
It was propped up there.
and it's just gone like that?
Fell on him.
Okay.
Well, I was down in the village hall when it happened. So I got running up here from village hall, and he sat outside holding a cloth and he's covered in blood. And all of a sudden it started running again, and then next thing, it was spurting. And I thought, oh my God, we can't cope with this now. This is too much. We've got to get somebody. But I never thought it would be a helicopter.
Obviously, we've come in the helicopter. We're not going to fly you because we can't get up to helicopter from here with you because it's a bit of a trek. So we're going to wait for a road ambulance to come from
that might be long.
wherever it may be. Yeah, it could be 10 minutes. It could be a bit longer. We don't know, but we're going to stay with you until it gets here.
Okay.
All right.
Yeah.
In Yorkshire, a spot of steaming hot tea is almost as good as medicine.
Get some paracetamol and you can have a cup of tea.
I'll have some sugar, seeing that I'm injured.
There you go.
She thinks I can cut me down.
Is this the length you have to go to get some sugar in your tea?
Keith's a retired mechanic and classic car enthusiast. The couple was supposed to be going on a rally tomorrow.
Hi, desk from Medic 1. Do we have a ETA, please?
Yeah, so I requested a P2 for you about 10 minutes ago, but there's still no one that's been allocated on it. As soon as there is, I'll let you know over.
Obviously, thanks.
Ambulances are thin on the ground. Keith's feeling much better, but Lindsay's not convinced. She's carrying out neurological tests.
Can you do this? So, almost like you're counting. I know, come on, do me a favour, keep your head still and just with your finger, touch your nose, then touch my finger. You can use it, that's it. And then do it again, touch my finger. There we go. Touch my finger. That's it, touch my finger. Right, perfect.
The ground ambulance crew have arrived.
Let Lindsay hand over.
Okay, mate.
And his head stopped bleeding. He's going to need some glue, or maybe some stitches at hospital. So the plan is Lindsay will hand over Keith to them, and they'll make their own way to the local hospital, Barnsley, we think.
And his left pupil is non-reactive, but that's normal.
But that's all normal.
Yeah, that's all normal.
Thank you. Cheers, guys. See you soon.
Thank you. There you go.
Keith will soon be on his way to hospital, where his injuries will be fully assessed. For Mikey and Lindsay, it's back to base.
So he's actually got an arterial spurter there?
Yeah.
30-year-old Andrew Stewart was lucky to survive. He was in a coma for 3 weeks after suffering a brain injury when he was hit by a car on his way home from work.
I can't remember anything of the day of the accident when I woke up. Well, that's the last time I remember anything.
CT scans found Andrew had bleeding on the brain and a fractured skull, as well as a severely broken left leg, which surgeons fixed with bolts and screws. He spent 5 weeks in hospital before returning home to face a long recovery.
I used to love fitness. I can't do that anymore. I can't run or anything like that. But in general, day to day is fine. You know, I can get on my day-to-day life. I can walk on it, just get tired every now and then.
No charges were brought against the car driver. Today, Andrew remains grateful to the air ambulance team who saved his life.
The doctors, nurses, I guess policemen, firemen if there's anyone there. And I'm very grateful because without them I wouldn't be here today.
Horse has gone forward, she's gone forward with it, then it's booked.
Hospital doctors found rider Yvonne Late suffered severe concussion when she was bucked off her horse at a riding stables. Her helmet saved her life.
Can't put a price on decent kit, can you?
Yvonne had debilitating headaches for a month and returned to work on reduced hours. She's now back in the saddle, but is choosing smaller and quieter horses.
Hello, my name's Steve. How are you feeling? Have you got any pain there at the moment?
After collapsing in the street while moving a neighbour's furniture, 75-year-old Malcolm Wykes was discharged from hospital the same night when all his tests came back clear. Investigations are ongoing into Malcolm's angina, and he's avoiding doing anything too strenuous for now.
Got into that tree on the bike.
Motocross rider David Kerr suffered multiple internal injuries, including a torn liver and kidney and several broken ribs, when he came off his bike on a woodland trail.
That's his helmet, there's no impact damage on it.
He also punctured his lung and ruptured his bladder. After 3 weeks in hospital and several more recovering, David's returned to his roofing job and is planning to get back on the bike track soon.
What's your name?
Keith.
Keith.
Doctors kept 83-year-old Keith Horn in hospital overnight after an iron bar toppled over and struck his head during some work on his beloved classic car.
Only thing, it was me, not the car, thank goodness. I was very, very fortunate that I hadn't passed out. If I had passed out, I shouldn't have been here talking to you now. You carry on now, love, you tell them. You tell them, I've done my talking.
Well,
I've had me 2 pence.
And Keith and his wife are very grateful to the ambulance service, from 999 call handlers to helicopter crew.
I couldn't thank our air ambulance job. They were superb.
Brought him back in the house when he started shaking. She was very good on the phone and she told me what to do. I looked up and there it was, this big yellow bird, and I thought, but I never dreamt for a minute it was for us. I said to you, didn't I? I said, somebody over there's having a bad time because that's landing in village. 2 minutes later, they're on the door.
Keith's wound was cleaned and glued back together in hospital.
Next day, he's walking round and he hasn't even got a plaster, a bandage and a nothing anywhere. He looked like he were a complete fraud.
Seats is cold, love, this morning.
Keith and Sandra are now free to get back to their classic car rallies.
We're able to go out, get off, enjoy ourselves, and hoping that we enjoy ourselves for many more years without any more mishaps.
That's 99 lifted.
They fly in some of the UK's most dramatic landscapes.
Okay, the weather's starting to close in. I'm worried I can't get over the ridge. My escape option at the moment is to go up.
From high-rise city centres
It's going to be bumpy, it's going to be turbulent, guys.
to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, Alan?
The crews of Yorkshire's 2 air ambulances risk their lives
Gone unresponsive. It's just gone unresponsive on us.
to save yours.
There's potentially fatalities involved.
That car's a right mess.
Delivering intensive care by air.
It's not safe.
There's a lot of blood there. There's a lot of blood there.
No matter how critical the case,
This is the first time anything like this has ever happened.
We're circling a house fire.
however risky the place,
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee. You're having a heart attack, okay? The heart is blocked. Let's get loaded and go.
going to extraordinary lengths.
Hey, this from Medic 2 at the patient's side now, over.
With humour.
You might get rest at week off if you're lucky. What is it, Thursday? Yeah.
And compassion.
Okay, Chick, we're just going to get you out, alright? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
So I think he has dropped straight down there then.
In the Dales, a cyclist is seriously injured when a crash catapults him over the side of a bridge.
You're grunting, why are you grunting?
Because my legs hurt.
We're going to need at least 2 ambulances, aren't we, I think?
A couple and their dogs are involved in a crash off a busy motorway.
They've just rolled straight off, it's rolled about 8 times.
And high on a hillside, Dr. Neil faces a tricky ankle fracture after a woman's dog walk goes wrong.
You keep going on that Antonoxetine, you're doing really well.
At the Yorkshire Air Ambulance HQ, the scramble siren is sounding. The crew of Helimed 99 are being called to the Dales. A cyclist has fallen over the side of a bridge.
Engines go to flight. Confirm both flight and guarded. Confirm. Visors down. Okay, over the blue line 101, he's a piece of good tail coming round.
On board today are paramedics Sammy and Al, and Dr. Steve.
So we get called to see a lot of cyclists, especially out in the Dales, a beautiful place to ride your bike. Unfortunately, as a cyclist, you're relatively unprotected from the road and other road users. You may have a helmet on, but often wearing fairly lightweight clothing, lycra, that sort of thing. So the injuries sustained can be significant.
So from Reef, I think it'll be obviously James Cook and Darlington probably.
We've had reports that a cyclist, I believe a road cyclist, has come off his bike and fallen over a bridge, and on landing has broken his leg. We're unsure as to the actual severity of this injury. There may be more injuries that weren't initially appreciated on the call.
Pilot Elaine is racing her team to the heart of rugged Swaledale.
So 2 minutes to run, yeah, and looking at it, if it's a bridge, it is literally going to be where the stream is, isn't it? I'll do an orbit and see what we've got. Okay. It looks like where that white thing is on the nose.
They're straight on the nose.
Literally on the nose. We might have to find somewhere flat by the stream.
Pilot Elaine will rely on 20 years of flying experience to safely land the helicopter in this hilly terrain.
Can you see that little sort of scar above that dark brown bit on the far side of the stream? That looks big and flat enough, doesn't it?
Alright mate, I'll give that a go. Head desk from 9-9. Official is seen, final approach. Over. All looks good left. Got this bank on this side.
Just come right one, Elaine.
Yeah, mate.
Looking good. Eyes on the tail.
Cheers, guys.
The local mountain rescue team have been tending to the patient.
I've just been down with him. Yeah. I've cut his boot. It looks like he's got a tib and fib.
Okay.
He's got cap V filled, sensation, and I've got a pulse in his foot.
Lovely.
The cyclist was catapulted over the side of the bridge. It's a 15-foot drop.
Get it on his bike towards the middle of the road.
So I think he has dropped straight down there then. I was wondering if the bike could come down the hill a bit, but wow.
Hello buddy. My name's Al, this is Steve. Hiya. How are we doing?
Good. I'm in a lot of pain.
Okay. So you've come off the bridge, have you?
Come off the bridge, my leg is snapped.
24-year-old local pub chef Cameron Durdy landed on the rocky stream bed below.
I'm just going to have a quick look at your top end while Steve starts to look at your leg, okay?
Behind you a minute, Cameron.
Okay. Okay, so just first of all, I just want to check your neck. I'm just going to press on and I want to know if it hurts. We're all right there?
Yeah.
Yeah. Okay. I'll go down a bit more. And this is all okay down here?
Yeah.
You're grunting. Why are you grunting?
Because my legs hurt.
Get some IV access, some stuff, and we'll get that sorted. This chap had unfortunately come off on a corner where a river went underneath a bridge, and he'd gone over the parapet of the bridge down onto the riverbank. Fortunately not into the mainstream of the river, but landing very close by. Up in the Dales you get these steep-sided valleys and rocky riverbeds, and as we were overhead the scene we could see this was going to be quite a difficult job. I'm not allergic to anything that we know about.
Wasps.
Wasps. Okay, I'll put them away.
Cameron's leg fracture is serious. The bones have pierced his skin. Without swift intervention, paramedic Al knows there's a danger he could lose his foot.
Analgesia wise, Al. Start with morphine or should we just go?
I'll give him some ketamine because that's going to work.
For the K, yeah.
We'll pop that there, man.
You're naked without a chain.
Right.
That my right arm is holding my.
I know, so I'm going to. You keep it holding it and I'll wrap this round, okay? So it might seem like we're not doing the right lot, but that's because before we start arsing about
whatever you've got to do, man, just do
before we start arsing about with your leg too much, we want to get this painkiller on board, and then once you're feeling a bit more comfortable, we'll do some more stuff to your leg. Okay.
Cameron was lying where he fell for some time before passers-by found him.
My husband and I were coming to walk our dog, and we essentially came over the bridge and noticed that the gentleman was down here. To be fair, I'm fairly surprised he's conscious and fairly happy with it, to be honest. Didn't lose consciousness and didn't hit his head on any of the rocks, which the brook's quite low at the moment, so it's a surprise.
I quite like the sound of a babbling brook. Do you? I think if I was going to have an accident, I'd quite like to be beside.
This has been my painkiller so far.
Yeah, it's quite nice, isn't it?
I feel like my pain is just going down the river a little bit.
It's calming.
Nice way of looking at it.
Need a bit of that.
Pop that on there. There we go.
Cameron's leg will need to be straightened where he lies. Dr. Steve is giving him ketamine. It's the strongest drug the team carry, and it can cause hallucinations.
Right. Are we ready for a journey? Have we got splintage and stuff?
Yes, Sammy's just behind you, I think.
Super. Okay, we're going to start gifting this in. Okay, Cameron. Now, like any visit to the bar,
best to take it slow.
we're going to go one round at a time. Okay, I'm not expecting you to buy any rounds tonight. We'll start a little bit. Okay, the beauty with a little bit is we can always give a little bit more. But we'll see if we can hit that sweet spot where you don't care as much. Okay, and the pain goes away. Now, ketamine can be a bit dissociative, can make you feel a bit spacey. I want you to focus on the fact that we're here to keep you safe. So think happy thoughts. Okay.
I think that's starting to do something.
Yeah, it's doing something, isn't it? Yeah.
Whoa.
Okay. It's good, isn't it?
That was quick.
Yeah.
Once Cameron is fully dosed up, the team will straighten his leg.
Are you ready for your next drink yet, sir?
Yeah, go on. Maybe just a half. Yeah,
just a half, you reckon? Okay, buddy?
You alright?
I'm good. How are you?
If it weren't for that, I'd be in a lot of pain, I think.
Yeah, is the pain sort of eased off a bit now?
Yeah.
Ebbed away, just flowed away with the river, yeah?
I don't even need my leg anymore, man.
Cool.
Oh, that's not what it's supposed to look like.
No.
What's that?
It's a alternative anatomical arrangement at the moment. Got another half?
Yes, please.
Okay. Ketamine is a very strong drug that we use. It's got pain-killing properties and sedative properties. In this instance, we used it for both of those, so the patient kind of forgot what we were doing to him when it was painful, but had some pain relief. Ketamine, though, has some interesting side effects, as we found out in this case.
So in a minute, I'll give you a hand. We're just going to support his leg from underneath as much as we can, so it doesn't move about very much.
Yep.
And then while you're doing that, I'll take the boot off, and then once the dressing's on, we'll just slide the splint in underneath and try and straighten the leg out a little bit.
Bit of a spot there, Cameron. Yeah, sweet. Okay, let's get this sorted out.
Ketamine is fast-acting and short-lived. The team must work quickly.
Close your eyes.
Yep,
Put yourself in your happy place.
Yep,
okay, it'll be over in 20 seconds, and you'll be in a better place just then. Okay.
Okay, you ready? We're just going to have a little pull.
That's it. Straight leg there, Cameron.
Okay.
Let the guys take the strain. You can relax your arm. Okay.
One more.
That's fine.
They're using traction to pull Cameron's leg back into alignment.
Ow, I'm in pain.
Okay, you can have some more medicine. Good. Alright, it's a bit more leg shaped. That's what we're aiming for, isn't it?
That is more leg shaped, yes. Good. Okay, thank you guys.
That's alright.
Cameron's leg is being wrapped in a vacuum splint, ready for transportation to hospital.
Can you feel that?
Ow.
Okay,
Yes.
wiggle your toes for me.
Okay.
Alright, now what we want you to do now is get onto this stretcher.
Okay, you can grab my arm if you want to. That's it, buddy. Bit of a support of her. Yeah, put that leg down straight and we'll put the other one next to it.
Thank you for your help.
Oh, you're welcome. There's not many places we'd sooner be, to be fair.
No.
Inside a nice little brook in Swaledale.
With ketamine, it's all about setting the scene, I think, and everyone does it in a different way. But often, as long as you tell the patient what they're about to experience so they understand it, continue to maintain verbal contact so they are touching base with some reality, and keep talking to them and reassuring them, as with Cameron, it can be actually quite a smooth and not unpleasant experience.
After his 15-foot fall, Cameron may well have other hidden injuries.
Then got hands on? Yeah. On 3 then, 1, 2, 3.
The mountain rescue team will carry him up the steep slope to the waiting helicopter.
Well, it's a nice bike as well.
It's an e-bike, yeah. She could have been going at a fair lick.
Yeah.
A little bit of scuffing there, but...
Yeah.
Everyone ready?
On lift. 1, 2, 3. Lift.
Keep going. Keep going, that'll do.
Cameron will be flown to the major trauma centre at the James Cook Hospital in Middlesbrough.
Are you ready for a little top up?
Yes, please. Yes, please. I'm starting to really feel like I'm in a lot of pain.
Okay, that's no problem at all. You can ride that all the way.
Engines both to flight. Confirm both flying gate. Confirm both. Doors harnesses stretcher. Close secure.
We're all good in the back.
And closed and secure in the front.
It's 34 miles to the hospital and just a 13-minute journey by air.
H145, we've got 6 on board, just lifted from Swaledale and we're routing to James Cook.
How much ketamine have you given me, Steve? 100. You going to give any more? No, I think we're okay.
With plenty of painkillers on board, Cameron is now comfortable. Much more comfortable. It's not often the medical team is serenaded.
Almost like a monastic chanting, isn't it? Beautiful.
Are you looking at his book?
He's singing to us.
Oh, is he?
That's probably it.
As long as he's comfortable.
So this was a first for me. I've never had a patient serenade me on the way to hospital. He was clearly a very musical chap, and as he was coming out of the ketamine sedation, he felt disinhibited and tuneful. So serenaded me all the way to the hospital. Wasn't sure about his musical choice. Come Fly With Me would have been good.
After an entertaining flight, pilot Elaine prepares to touch down at James Cook Hospital.
Good on your side? Yep, you're still good. You're clear with the light stanchion at this angle. Let's come forward a little bit. Roger.
This journey would have taken an hour by road.
Ed Ask from 99, landed, James Cook.
Thank you guys for looking after me.
No worries, Cameron. Welcome to Middlesbrough.
Yeah.
Cameron may be in full voice, but he's been lucky to survive a 15-foot fall, and his injuries are serious. He will need surgery and will be months in recovery. $300,000 cars travel on the M1 motorway each day, and the air ambulance team cover a 47-mile stretch of it.
Guys, I might have a job for you.
Dispatcher Matty's on the line to first responders. It's a motorway crash so bad, backup is needed urgently.
I believe there's 2 patients trapped in this car that's rolled on motorway. There's a DCA with a similar ETA to you and they've allocated heart as well, over.
Dr. Neil is straight to it. Pilot Elaine will be flying him 10 miles north.
100, 101, piece of good.
We've been tasked to an RTC road traffic collision on the M1 for a vehicle that's been reported to have been involved in an incident and has been described as a rollover, as the vehicle's physically rolled itself over on the carriageway. There's no crew or scene update at the moment, so we're not entirely sure the nature of the injuries. At high speed on a motorway between sort of 60, 70 miles an hour, you can have significant life-threatening injuries.
Paramedic Andy is helping navigate to their location.
We're probably about 1 minute away. So it's south of Junction 47, and we're talking north of Garforth. That sort of south area.
Yeah, affirmative, north of Garforth.
Yeah, well, as I skinned, mate, the traffic is still moving in both directions with what we can see from here.
Roger, there's another note just come in now. Fire on scene.
Between junction 48 and 47 southbound.
Yeah, Roger, mate, we've got visual of scene. We've got the fire appliances. That car's a right mess.
We could see that the vehicle had come off the motorway through the barrier and down the embankment on the side of the motorway and had then rolled into a field. Lots of damage to the vehicle, lots of debris lying around.
The car has come off the southbound carriageway. It's not clear how many casualties are involved.
Is that close enough, or do you need to get closer?
Up to you, mate, whatever you think's. Without disturbing the scene, I think that's probably good there, mate.
They in or out of the car?
I think there's one in and there's one out.
I think, yeah.
As we approach the scene, I can see there's two elderly patients who are occupants of the vehicle. One sat still inside the vehicle and one sat on the ground next to the vehicle, being attended to by the ambulance crew that arrived before us.
They've just rolled straight off. It's rolled about 8 times.
Yeah.
So
we're going to need at least 2 ambulances, aren't we, I think?
And in this unfortunate case, we can see that there were a number of dead dogs and a number of injured dogs still moving around on the scene, and the fire and the police service were trying to manage those animals.
Can you remember what's happened? Have you been unconscious?
I don't think I've been unconscious.
Not while we've been here, I've been unconscious.
He's been coherently talking, communicating.
Conversation.
I'm just going to have a look at your chest. Sorry.
73-year-old Dave King has no idea how his car came off the road. Andy isn't taking any risks. Although Dave's awake and talking, he's likely suffered significant injuries.
Any pain in and around your pelvis and groin?
No.
Any pain in the back of your neck?
No, nothing.
No.
Dave and his wife Jennifer were on their way home from a holiday with their 5 spaniels. All the dogs were thrown from the car in the impact. Only 3 are still alive. The fire brigade are doing what they can for them.
Are they your dogs, are they?
They're all rescues.
Are they? Oh, bless them.
So this is a really sad job. I think as the medical team we have to make sure our focus stays on treating the driver and the passenger of the vehicle. We're not in a position to treat the animals, we don't have any training to treat the animals. Fortunately we've got the other emergency services and we all work together as a team.
Ready, steady,
up. That's just because I'm 73.
Don't worry.
You don't look it.
You've been very lucky.
We'll come back down when we get over there.
We're just going to walk him to your vehicle. Are you in first vehicle? Yeah, nice.
Obviously if I'm going up there,
yeah,
I'm not going to see my wife, am I?
No, but that's fine. We're looking after her. She's sat up and talking as well. All right, and we'll get messages between you, but at the moment we just need to make sure that medically you're okay. All right, Dave.
In the wreckage of their car, Dave's wife Jennifer is being checked over by local paramedics. It looks like she has a head injury. Dave is disorientated.
Where were you heading?
Manchester.
Okay. Right, okay.
Is the speed that's come down
here? Yeah, it is, yeah.
Okay.
Yeah, try not to think about that.
As well as physical injuries, serious accidents can also be psychologically traumatizing for the victims.
I've got 2 dead dogs and one who's on his way out. The other one's bloody 50 and he's survived.
You clearly love them and they're better off for having been with you as well anyway, yeah?
Oh no. The last thing I can remember is watching the speedo and setting me cruise control.
Okay.
That's all last thing.
Right. Can you remember rolling or?
No.
Right, okay, so possibly a brief.
Being driving and being...
And being in field, you can't remember.
I can remember being upside down in the trench.
Right.
And then it rolling upright.
Yep. Oh, so you can remember the actual roll?
From
what, a point of it?
Right, okay.
Well, in the suitcase in the back seat.
Yeah, we'll have a look round.
Amazingly, his wife Jennifer is also able to walk out of the car into the waiting ambulance, but she's had a bang to the head and is clearly shaken.
So the vehicle to our right has come off the motorway, the M1 southbound, I think, and rolled down a grass bank through a ditch to land on its wheels the right way up. Significant speed possibly, so the potential for injury is really high, but modern vehicles with airbags and the fact that they've rolled down a grass bank into a soft field has possibly saved their lives in the context of what's actually happened. So both the patients in the vehicle are what we would describe as walking wounded. So they've got some minor injuries, they need to go to hospital for a check.
Do me a favour, Dave. Take my hands, pull me towards you, push me away.
Paramedic Andy's carrying out neurological tests.
Kick your leg forward. Oh, other one. That's it. Pop it down, kick your leg forward. Nice one. You sit yourself on there, lovey. Alright.
Thanks
Yeah.
for everything you've done.
Bad day. I wish it.
Next time I see you.
Yeah. I wish you well. Alright, for a speedy recovery, especially the hand. Alright, but it's, yeah, just one of those days.
Dave and Jennifer have been lucky to escape with their lives, but paramedic Andy has serious concerns.
She's got some pain across her chest, but it seems like bruising. But I always worry with people of that age, they're always going to fracture the sternum, aren't they?
The full extent of the couple's injuries will be determined in hospital, and it's not yet known if the surviving dogs will make it.
Yorkshire Ambulance Hospital Air Desk.
On the air desk, paramedic Lisa is just beginning the late shift,
Do we have a name for that passerby?
and an ambulance controller on the line. A car has crashed on the M1 motorway.
So this job, somebody's on the motorway, they've seen someone in a vehicle, just missed their car, they think they're unconscious at the wheel and they've gone down the embankment.
100, just over the blue line, T's and P's are good, miles clear.
The Nostell crew are on their way. On Lisa's team today are paramedic Al and Dr. Paul.
We're just going to a car that appears to have come off the motorway. It's actually come in from a driver on the motorway that's phoned the police, and the car's just swerved straight in front of him and then shot off the side of the motorway, and he seems to think that the driver of the car was unconscious prior to actually coming off the motorway. The particular concerns for high-speed impacts are internal injuries, so things that we can't see. So that may be significant injuries to the chest and to the lungs, to the abdominal cavity causing bleeding, or to the pelvis itself with significant fractures.
Doncaster, good afternoon. This is Telemed 98 Alpha. H145 out of Nostell, been tasked to a job near Hart Hill, Sheffield area. 5 on board, looking for a basic service, please.
Pilot Elaine is flying the team 22 miles to a section of the motorway south of Sheffield.
It's right near Woodall Services.
That's it, yeah.
Yeah, Woodall's quite a long way south. Yeah, it's right on the border with EMAS.
It means the team are now flying a long way from emergencies in their own patch.
Al, my eyes are in a minute.
I'm looking out.
In just 9 minutes, they're over their location. 500 feet below, police have closed the road around the wreckage of the car, which has come to a rest on a parallel minor road.
I'll try and get it on the road, but I'll go from the other side, so I'm not going to cause a problem too much. Right, I need you clear of obstacles on both sides.
I'll keep an eye behind and road and tail. Yeah, about there's good now, Elaine. You'd be good on the left here, yeah. And you're good behind?
Good on the right? Good right. Good right.
Just straight down now, I think it'll be fine.
Just be careful when you're getting out, guys. Yeah. Straight ahead, yeah? Yeah.
27,000 people die or are seriously injured on Britain's roads every year, and this driver has had no medical attention.
I'll let you have a chat with you if that's all right.
Yeah.
To the medical team's surprise, he is conscious and talking.
What's the plan then? What's been happening?
I'm on the way home.
77-year-old Joe Hillam is making light of the situation, but he slewed off the motorway and bounced 100 yards over 2 embankments before finally coming to a stop.
And do you remember leaving and coming down here?
I remember closing my eyes.
Right. Oh, crikey.
This man had been through a huge ordeal with the high-speed road traffic collision that he'd been involved with. He was laughing and joking, but my concern was that actually he seemed like a fairly stoical Yorkshireman, and therefore my concerns were that actually he had some more significant underlying injuries that we hadn't found by that point.
No pain anywhere?
No, nothing, I'm fine.
Were you wearing your seatbelt?
Yes, oh yes.
Right, okay.
Might be a bit tight at the moment.
Yeah.
Heart rate is 130 as it says on the monitor.
Right.
Radio, let's go with that, I think.
No other vehicles were involved in the crash. Lisa and Paul are concerned there may be medical reasons behind the loss of control.
No problems with your breathing?
No, none at all.
Do you don't feel short of breath at all?
No, I feel fine.
I'm just going to go up your top.
Right.
Excuse me. You just take some nice deep breaths.
Joe's heart is racing.
I'm just recovering from COVID.
From what? COVID?
Yeah.
Ah, yeah, right. Right, young man, your oxygen levels are a little bit low. Well, they're quite a bit low. Have they? Okay. How long ago did you have COVID?
Last week.
Last week?
Our trip out came out last week.
You came out last week, right? Because your oxygen levels are lower than what's normal for you,
right,
and your heart rate's a bit fast, I think you should go get a check over at hospital.
Right, but not today, surely.
Lisa is at a loss to know why Joe is resisting a hospital check.
So he's saying his oxygen levels are normally low, but they're normally about 94. Recovering from COVID, he's just come out of isolation last week, so that's probably got something to do with that.
Heart rate.
But his heart rate, I said he should go to hospital, but he don't want to go.
No, I'm not going to hospital.
I really think you should.
I've really had enough and I'm not going.
I know.
Definitely not. I'm going home. That's the thing, my next point is home. My home. I just want to be in my home.
Yeah. What about if you just went to hospital for a quick checkup?
No, I'm going home.
And what if you get poorly at home and there's nobody to help you?
Well, at least I'm going to die happy in my own home.
So unfortunately we're still seeing some of the long-term effects of COVID, and for some people who have been admitted to hospital through that time, they've had some truly horrific experiences, and I think for a lot of people they never want to go back to the hospital experience, which is entirely understandable.
I'm sorry, I've seen enough of hospitals. I'm going home. I was on that corridor watching people there, and nobody was taking any notice. I mean, on a corridor, 14 and a half hours in a chair, and we were actually watching people die. They were letting them die. They weren't even anybody saying hello to anybody or watching them. Well,
that might just have been a really bad day that they were having.
Dr. Paul is hoping a phone call to Joe's stepdaughter will persuade him to be checked over in hospital.
Sounds like he's had a pretty grim time in hospital recently from what he's telling me. And he's fairly adamant that he's not going to hospital. Even though he's talking kind of entirely sensibly, and I absolutely get what he's talking about, and it sounds like his time in hospital was pretty horrific. It's the first time I've met him, and for somebody to have that heart rate, his blood sugar levels are really high and his oxygen's pretty low. I'd be very, very reluctant to let him go home, or even to be able to say that he's kind of weighing everything up, properly. I almost think it's one of those where I completely understand that he really doesn't want to go to hospital, but at the same time, he really does need to go for a checkup. I don't know if you want to have a chat with him or not, but that's kind of where we are at the moment. There you go, it's Beth.
Right.
Have a chat with her.
Yeah. Hello, Beth. Yes, sort of. I'm not going. I've told them I'm coming home.
The team have a duty of care to their patients, and Joe's reluctance is putting them in a difficult position.
I just don't know how we're going to make him go.
Well, neither do I, and that's what I was trying to say to Beth, and we'll try the softly approach, but at the same time, I just don't think medically legally he can go.
What did your daughter say?
You do what you want, Dad. You know your own man. Yeah, she knows I won't go.
Right. How old are you?
77.
Right. The thing is, age and speed don't go together very well.
Don't they?
You've come across all this.
Yeah, I know.
Your car's not looking right, cracking on back of it.
Well, no, but I mean...
And you were in it.
Yeah, well, but I'm fine.
I'm going to spin it on its head, okay? So you may or may not be fine when you go home. You probably will be. But all I can do is I can ring the hospital up now, whichever one you go into, and I'll check with these guys to tell them you're coming down and ask if they'll have a look at you when you get there.
Immediately.
That's the best I can do, is to give them a call now.
If you don't do it immediately, I'll just get to walk out.
I know, and I'm not trying to be a pain in the arse. I'm trying to just be straight with you, okay?
If I aren't in,
yep,
and out of the hospital within an hour,
yep,
I will get up and walk out.
Yeah. Right, let me get on the phone and give him a ring. Let me find out where we're off to.
Have you got anything else valuable in your car?
At last, Joe has agreed to go by road to Sheffield's Northern General Hospital for the checkup he needs.
I'm going to ring the hospital, okay, so they know you're coming. We don't want to force people to do anything, but I'm not entirely convinced this gentleman fully remembers what happened today. And we have something called capacity, so we have to judge whether people can make decisions for themselves. And I'm not completely convinced he's absolutely understanding the risks and the benefits of him not going to hospital. So we've not had to force him to do anything, but he has kind of reluctantly agreed that he'll go to the hospital to get checked out, so we can have a real good look at him.
So I'll leave him with these two chaps. Nice to meet you, buddy. See you later, Joe. Yeah, see you later, Joe.
It just breaks your heart really when you think of people that are lonely, that are isolated, that have got through these COVID times all by themselves, have had to go into hospital and witness these sights. It's just so distressing for them and so upsetting for us as healthcare providers. You know, we all try our best, we're under extreme pressure, and despite all that we want to deliver the best patient care that we can.
Joe is heading for comprehensive tests in hospital to get to the bottom of why he careered off the motorway, though it's not certain if he'll be seen straight away. At Nostell Air Base, paramedics Pete and Sam are being scrambled to an injured walker.
What's the job? Woman that slipped on a hill, foot pointing the wrong way, on Ilkley Moor somewhere, I think.
Hello, 98 Alpha is adjusting to 1,300 feet.
On board with the team today is Dr. Neil.
We're going to Ilkley Moor for a lady who's reportedly broken her ankle, and there's some suggestion that it's not pointing in the right direction, which suggests that the blood supply could be compromised to her foot, and I imagine it's rather painful, and she's some distance from the road, so we will be able to land relatively close, make an assessment, and if necessary we can give her a strong painkiller, something like ketamine for example, and make her foot straighter and improve the blood supply, which may improve its recovery and healing, and actually the survival of the foot if it's really at an odd angle.
Starting from Ennis. Yeah, but this detail upgraded.
By trauma desk, there's still one got a DCA attached to it. I'll let you know as soon as one is. Over.
Ennis 98, roger, that's all complete. 3 minutes drunk.
In 10 minutes, they are over Yorkshire's famous Ilkley Moor, which is popular with dog walkers and climbers.
Might actually be in trees or scrubland, this, which might make it a bit more difficult, because it appears to be a lot more trees on that hillside than there is on the map.
The moor rises sharply 1,300 feet above sea level. Finding a suitable landing spot could be tricky for pilot Harry.
I'm just going to do one pass just to see if there's anywhere, coincidentally, that's flat round there. Visual on the track. She's just in the trees there, the first tree that covers the track after it drops down. She's got a loose dog with her.
We don't get any further left there, or is there rock?
Now, what we're worried about is the ground is coming down from the path behind us. Tail is good. Oh, okay. Pete, can you just... I'm just holding a bit of power.
Yep.
Can you just step out for us and just confirm to me that we've not got any rocks or anything penetrating the bottom of the aircraft?
Well done, I'm on skid.
Thank you.
All looks good, that, Harry.
Cool. Okay, cool. Leave us down.
It's a quarter of a mile down a steep track to the injured woman.
You can understand how someone's lost the footing on here, can't you?
I've been up to EOC and MRT has been requested.
We're coming, we're not far off you. How bad is your pain at the moment?
Relatively bad. It was worse before.
55-year-old Tina Hornby dragged herself into the clearing and called 999 after falling under trees while walking her dog Dexter.
But you can start on this, so
right, okay.
The mouthpiece there, pop it into your mouth and take some nice deep breaths. Okay.
Tina's fractured her ankle badly and it's painful.
Got no pain up at the top
No,
of your legs?
I just felt, because I slipped slightly, I went, put my foot down, and I just felt it go.
Okay, no problem at all. So I'm going to have to pop a little needle into the back of your hand probably, just to give you some pain.
Okay.
Is that okay with you?
The break is so severe, the skin is developing a dusky hue, a sign the blood flow to her foot is compromised.
If we need some sedation, I'll put a green or something in. Yeah. This lady's got a nice vein, hasn't she? So might just put something bigger in.
Yeah.
Tell us if
Dizzy
it's...
again.
Yeah, that's fine.
That's good, keep sucking
It wears off really quick, so as soon as you start, we'll just stop feeling back. Bending it down a touch.
With the blood flow to her foot dwindling, there's a danger vital tissues could die. Dr. Neil needs to straighten it where she lies, but it will hurt.
So Tina, I want you to take 10 really big breaths on that Entonox.
Okay.
Okay? Nice, big deep breaths. Keep going, one after the other. You keep going on that Entonox, Tina, you're doing really well.
You've seen it there,
Yeah.
so it's just trying to get your foot back into the position it should be. Okay, if it's too bad pain-wise, you let us know.
Support her knee, turn your hands around, face the other way. Yeah, and I want you to stop me pulling her off the thingy.
So Sam's got to hold your leg, so we've just got something to pull against.
Yeah.
Okay, you keep breathing on that.
Really well, Tina, you keep going.
I feel it coming out to length, so that's good.
Dr. Neil is using traction to pull Tina's ankle back into alignment. It's not easy. The fractured bones are jagged and must align neatly without trapping any nerves or blood vessels.
Oh, hang on.
Yeah, no, I'm stopped now.
On the gas and air, we're going to have another attempt when you're ready.
Yeah.
If we can gently and carefully manipulate it, so you bring the joint back out, because if you fracture it, it becomes shorter, because things go from there to slip. So if we can bring it back out to length and rotate it back into a more normal position, anatomical alignment that we call it, it can reduce the pain, so she's a little bit more comfortable afterwards, but it also helps where the blood vessels may have been squashed and constricted.
So keep breathing.
Dr. Neil has done it, and colour is coming back to Tina's foot.
How does that feel compared to what it was before? Same?
Yeah.
Yeah.
So I can feel a peel now.
Yeah.
Blood is pumping to Tina's foot once again.
You can see it looks a lot better. It's not perfect, it's not quite back into where it should be, alright? But your skin is better.
Yeah,
and your,
better.
And your foot's a little bit pinker at the end.
Yeah.
I can't imagine it feels better yet. Though.
Yeah, it does.
Oh, does it feel better now?
It feels a bit better.
And it had gone completely numb, your toes, hadn't it?
Yeah.
Quite cautious over your ankles.
Tina's straightened ankle will be immobilised in a vacuum splint, ready for transportation to hospital.
We're waiting for mountain rescue because we want to get you down safely. We don't want to be tumbling, we don't want to be banging you around and causing any more injury to that ankle.
Tina's worried husband has arrived.
Hello, fella. Alright. So come and say hello, but don't trip over her leg. Alright?
Yeah. My foot was pointed that way before they straightened it. Fell on that steep slope. I was under the trees, they couldn't see me, so I came down here on my bum. He didn't leave my side.
Mountain Rescue are here with a specialist wheeled stretcher to get Tina off the moor.
The stretcher is here, we just want you in the middle, head up this end.
Gonna be alright.
Do you need some support on your arm?
I think I can.
Okay.
Right. Oh.
You alright?
Yeah.
It will be short work for Mountain Rescue to transport Tina to the waiting road ambulance at the bottom of the hill.
Anybody not ready to move? Abby's going to have a downhill. Okay, ready, brace, lift.
The blood flow to her toes was quite compromised, so it was quite poor. And she also had sort of a numb foot, so that could be a combination of blood flow and nerve entrapment as well.
Thanks. Cheers. Have a good flight.
Bye.
Could have used something much stronger like ketamine. And ketamine is a very strong painkiller and it's also a sedative. But we're in the middle of nowhere and sedating somebody is not without risk. So doing things simple is often the better option.
You'll do it bit by bit, yeah?
A&E hospital teams will take over Tina's care.
Really there yet?
For the air ambulance crew, their work on the moor is done.
You're grunting, why are you grunting?
Because my legs hurt.
Pub chef Cameron Durdy spent 10 days in hospital after being catapulted over the side of a bridge while cycling home in the Dales.
Thought it was just going to be a nice leisurely cycle on my lunch break, but I lost control at the bottom of Surrender Bridge. When I was in the air, I just remembered like the silence, and then landing felt a bit like waking up in a sort of weird way. I kind of knew that that was the biggest thing that had ever happened to me.
He was lucky to escape the 15-foot fall, with just open fractures to both bones in his lower right leg.
They were surprised to find quite a clean break when they x-rayed it. I had a funny thing with the medical students taking my x-rays, and whenever the image came up they all just went like, "Ooh," and I was like, well, you're going to have to get used to this, guys. At every angle they're all pulling faces, but the guy who was going to go on to do my surgery looked at the x-rays and said, well, this is really clean and hopefully should be quite an easy fix.
Surgeons pinned Cameron's fractured bones together, and after demonstrating his talents during the flight, he spent much of his long recovery practicing his music.
I've started going to karate lessons as well, which is, I'm surprised I can get through that. It can be very sore, but that's part of recovery as far as I see it.
It just rolled straight off, it's rolled about 8 times.
Dave and Jennifer remarkably escaped with just cuts and bruises after their car careered off the motorway and rolled down an embankment. The cause of the crash is unknown.
Any pain anywhere?
Just past my nose.
Of their 3 rescue spaniels that survived the crash, 2 later died, but 12-year-old Charlie is doing well. The couple have since taken on a further 2 rescue dogs.
What's been happening?
We're closing my eyes.
77-year-old Joe Hillam was checked over in hospital after his car careered off the M1 motorway at 70 miles per hour and bounced over 2 embankments.
No problems with your breathing?
No, none at all.
He returned home the same day. The crash was caused by a tyre blowout.
You keep going on that entonoxetine, you're doing really well.
X-rays in hospital found Tina Hornby had suffered a complex 3-part fracture to her ankle when she fell during a dog walk on Ilkley Moor.
It happened so fast. I slipped with my left foot, and as I went down with my right, that's where I heard the noise. I looked and I could see my ankle was just pointing in completely the wrong direction.
Really well, Tina, you keep going.
Tina went into surgery the next day, where her ankle was pinned and plated. She's still on the road to recovery.
The doctor actually said it could be 18 months before I'm walking completely correctly again. And even then, I might not get absolutely the full movement that I had before. I'm determined I'll be back up on that moor and back up on that hill. Nothing will stop me walking in.
Tina's injury was serious. Without a swift rescue and intervention, it could have been much worse.
Thank you very much. Thank you for getting me off that moor. I don't know what I'd have done without them, and for saving my foot as well, because realistically there was no blood supply.
Ready, go.
They did such a fantastic job, and they deserve every single penny they get.